Good morning, good afternoon, good evening. I'm not sure when you're going to be watching this, but my name is Julia Valine, and my presentation will be on the measles virus. I just wanted to say thank you before I started for being one of the best professors I've had. You were truly a great professor and taught a lot and made us all laugh, I guarantee, at some point in this class, so thank you again. Let's get started on this presentation. So we're going to start with the taxonomy. The measles virus is a part of the genus Morbillivirus. Actually, the measles virus is the prototype for this genus, which is the Morbillivirus, like I've said. We have a few different viruses down here that are also a part of the Morbillivirus genus. The most closely related virus to the measles virus would be the rinderpest virus. As we continue down the list, Peste des Petits ruminants virus, canine distemper, which I think we kind of all know if you have a dog, this is a virus you want to watch out for. The Phocine distemper virus and the Cetacine morbillivirus. As you can see over here, we have a little model. It's got all the different proteins, the RNA genome plus the N proteins, which is all put together is the nucleocapsid. And then down here we have the RNA polymerase, which has the L and P proteins. We're going to still continue on with the taxonomy. The measles virus is a part of a family called the Paramyxoviridae family and subfamily Paramyxoviridae. Sorry if I totally botched that. This family is a collection of enveloped viruses with non-segmented negative strand RNA genomes. These viruses are usually known to be highly infectious. They spread through the respiratory route, causes the immune system to be suppressed for a great deal, tend to cause large outbreaks that associate with high morbidity and mortality rates in areas that have never been exposed to the virus. As you can see down here, we have a little family tree, which is the family, kind of the big guy, which is the Paramyxoviridae, and then the subfamily Paramyxoviridae. And then we have our genuses down here. Like I've said before, the measles virus will end up in the Morbillivirus genus, and then we can see that the measles virus is our virus, and then here's the other two that I talked about earlier. So we're going to talk about genetic nuance. So the measles virus is a spherical particle. It's estimated to be 200 nanometers in diameter. There is a layer of matrix proteins beneath a cell membrane. Derived lipid envelope covers a core complex consisting of non-segmented, negative-sensed RNA genome that is packaged in nucleoprotein large polymerase associated protein and polymerase associated protein. The glycoproteins H and F form spikes on the envelope. The H-glycoprotein helps the virus attach to the receptors, of the cell that is being targeted. The F-glycoprotein helps fuse the virus envelope to the cell membrane, which then causes the core complex to be released into the cell. Microbial physiology. This virus will infect dendritic cells, alveolar macrophages, subsets of B and T cells in the lymphoid tissue of the lower respiratory tract, also the epithelium of the respiratory tract. There is a possible infection of the conjunctiva, skin, and other organs. The reason these areas can be infected is because the virus replicates in the endothelial cells, epithelial cells, and macrophages. The reservoir and environment. Humans are the primary host for the measles virus. It can also be a host in non-human primate families, so monkeys, orangutans, anything that's a primate. Although there is not an environmental or an animal reservoir to trace this virus back to, unfortunately. Its prime time for infection are usually during the winter and spring seasons. Pathogenicity and infectivity. So transmission would usually come from someone that coughs and sneezes, and then you as a non-infected person breathing in the infected person's droplets. Kind of an example would be down here. This is really gross, but this guy coughing, and then she's obviously now going to breathe in his infected droplets. The virus can actually live up to 2 hours in an airspace where the infected person coughed or sneezed. The virus lives inside of a person's nose and or mucus of the infected person. Pathogenicity and infectivity continued. The R0 value for measles is often to be reported as 12 to 18. This value means for every person who is infected with the virus will or can infect 12 to 18 people. 9 out of 10 people who have been in close contact with the measles virus will be infected. The transmission estimated rate is 70 to 100% to susceptible people. Virulence. For every 1,000 cases, there are 1 to 2 deaths. For every 4 cases, there is at least 1 hospitalization, and for every 1,000 cases, 1 person ends up with encephalitis. Descriptive analytical epidemiology. It was estimated in 2017 that 110,000 people, most of them being children, died from the measles virus. People who are at most severe risk are unvaccinated infants under the age of 12 months, and then people with suppressed immune systems, pregnant women, and people who cannot receive the vaccines because they're allergic or unable to receive it because of another issue. These other issues can do with funding from the government because not everybody can receive this vaccine, beliefs, etc. We're going to continue on with the descriptive analytic epidemiology. Any person who is unvaccinated puts themselves at risk for contracting the measles virus. People who travel to areas that have a high rate of contracting the measles, these areas could be Europe, the Middle East, Asia, and Africa. I've also put a map down here to kind of illustrate where these areas have severe high cases. Signs and symptoms, the fun stuff. Signs and symptoms usually start to appear 7 to 14 days after contracting the virus. Symptoms could include cough, fever. The fever usually could get up to 104 degrees. A person can have a runny nose, red watery eyes. After 2 to 3 days, cope-like spots appear. They're usually tiny white spots that appear inside the mouth. And here are the cope-like spots down here, and this is in someone's mouth. And then after 3 to 5 days of symptoms, the measles rash begins to appear in the face. Unfortunately, this picture does not show from the top of the hairline, but it usually will begin at the hairline and will spread down the neck, the trunk, the arms, the legs, and the feet. So we see his chest and his stomach are full of the red spots. All over his arms, we can see that his face is pretty red, and then all over his arms over here are full of spots as well. Small raised bumps could appear on top of these red spots that are on his body, unfortunately. Laboratory confirmation is needed in order to diagnose a patient for measles. Usually the laboratory tests are looking for a measles-specific IgM antibody in the serum, and then an RNA polymerase chain reaction from a respiratory specimen. Samples for these tests are usually taken from the nasopharyngeal area and also a throat swab. We get tested like this for strep, and then right now getting tested for COVID-19 both ways right now. Treatment and management. Unfortunately, there is no specific antiviral therapy. Most medical care will be supportive and help relieve a patient's symptoms. Although when children have really severe cases, they should be given vitamin A. As in down here, if they are younger than 6 months, they should be given 50,000 IU of vitamin A. Infants 6 months to 11 months should be given 100,000 IU of vitamin A, and a child a year or older should be given 200,000 IU of vitamin A. Control and prevention. Vaccination is absolutely the best way to prevent this virus. There are 2 vaccines that are available for people to receive. The first one is MMR. It covers measles, mumps, and rubella. 2 doses of this vaccine is recommended. If you only get the first dose, it is only 93% effective. So there's that 7% chance you could contract the measles virus. Now, if a person were to get the second dose, it's 97% effective, which would only leave them that 3% chance of contracting the measles virus. The MMRV vaccine is also available, and this one also covers measles, mumps, rubella, and varicella. This vaccine can be given to children 12 months to 12 years. So there's that range for them to get this vaccine. Otherwise, you would want to be vaccinated with the MMR. If a person were to have the measles virus, the best way for them to not spread the virus to other people is for them to stay home and isolate. They should isolate themselves for 4 days after the rash has appeared. And then thank you for watching my presentation. Once again, thank you again for being one of the best professors. Let me keep going so you can see the other references. But I really hope that you have a wonderful Christmas, and thank you again.